Hi guys, welcome back to my channel. I'm Khadija Hadishola. In my channel, I talk about everything related to women and midwifery. Today, I'm going to be talking about midwifery interview question, how to answer sepsis question. So, if you're looking for a job, you got an interview invite. This, you wouldn't know if this may be one of the questions you'll be given. So, don't forget to like, comment, share, and subscribe to my channel if this is something that interests you. This should be of interest to all midwives, especially those that are looking forward to migrating to another country or looking forward to career advancement, applying for jobs, and maybe going for an interview any moment from now. Okay, so please don't forget to like, comment, share, and subscribe to my channel. When you subscribe, don't forget to turn on the notification button so you get notified whenever I post a new video. So, how to answer a sepsis question in midwifery interview. The first thing you need to know is criteria for, how do you know that this is a sepsis question? Sepsis is an infection. What are those cardinal things that they give you in the scenario that you know that this is a sepsis question? So you really need to know when to, differentiate, when to identify that, okay, this question is coming to is looking like a sepsis question or is a sepsis question before you really be able to answer the question. So the most important thing is sepsis question is that there's going the observations they're giving you. So there's going to be like maybe one thing that is abnormal at least, and it has to be something related to the temperature or the pulse. That the temperature is high, the pulse is very high as well, or the lochia is offensive. It's a postnatal patient, they might tell you that the lochia is offensive, or every lochia offensive, so deficit of infection and all of that. But most importantly, there's going to be a raise in temperature or raise in pulse. Okay. Sepsis question doesn't necessarily have to have abnormal blood pressure, but definitely there will be an abnormal observation. If they give you the question and it's only pulse that is rise, that's about the temperature. What's the temperature of the lady? Is raised as well, okay? And you want to confirm if this is an antenatal patient or a postnatal patient. The threshold for raise for sepsis in antenatal is different from postnatal. On antenatal, anything 37.7, 37.8, 37.9 maybe is considered as sepsis. Postnatally, from 38 is considered as sepsis. So now, having understand that, okay, this is a sepsis question, what are you going to do? What are you going to do? So the next thing you need to do after identifying that this is a sepsis question, you request for obstetric review immediately. Of course, you communicate with the woman, you tell the woman what is going on. Of course, you communicate with the woman, you tell the woman what is going on. And you take blood samples for investigation. What are those bloods you are going to take? And so you're going to take full blood cans. You're going to take blood LFT, liver function test. You're going to take blood for what's it called, blood gas analysis, yes, just to analyze if there's anything in the environment. You're going to take eye vagina if the lady is it if she's in labor, low vaginal swabs, eye vagina depending, so eye or low vaginal swabs. You tell me to take urine for urinalysis, and you send for urine MCS. Yeah, you take what other blood you don't need to take really. Infection markers really, so you check if to confirm any infection. Then after taking those blood, the next thing you need to do now, you get the doctor to you give prescribe antibiotics and antipyretics, and you give IV fluids. Of course, they all have to be prescribed. Ensure you do the, you take the bloods, all of those things before giving antibiotics or any medication. And also, if she's pregnant, you want to do a CTG to be sure baby is fine. So you connect CTG and you recheck the observation in an hour. You recheck the whether it's temperature, whichever is high, you recheck this in an hour, and you connect, the CTG to be sure baby is fine. That is what you need to do for the sepsis. And of course, the further things will depends on the results of those investigations, and will depends on the result of those investigations and how the patient is feeling. Is she feeling unwell or is she feeling well? If there's low oxygen saturation level, you may need to give, international in, intranasal oxygen as well. So you treat the patient according to the symptoms, and you get, don't forget to always escalate and seek for obstetric review. Yes, you know what to do, but then you have to seek for obstetric review, and it has to be immediately. So the lady should get antibiotics or antibiotic within 1 hour of the diagnosis, and you have to make sure that you take the bloods before giving the antibiotics. This is just a general thing, really, but it might be a slight different based on trust to trust. But for an interview question, I think saying all of this is okay when you're asking a septic question. First thing you need to identify that this is actually a septic question. The situation is it an antenatal patient or postnatal patient? So antenatal state patient, you do a septic screen, you do CTG monitoring, you give prescribe antibiotics, antipyretics, you recheck temperature in an hour. If it's an antenatal patient as well, you still need to do the septic screen, give antibiotics, and the difference is you won't do a CTG monitoring because she's delivered already. And in antenatal patient as well, in postnatal patient, you want to check the vaginal discharge. Is there any, the lochia, is there any offensive or something? So that is that for that. If you have any questions, don't forget to say it in the comment section, and don't forget to share my videos to other people so they can benefit. Thank you so much for watching. I'll see you in my next video.